Welcome to the HealthiHer podcast. Your host, Dr. Amy Brenner, is a board-certified OBGYN with additional certifications in functional and integrative medicine. This podcast is meant to help women find reliable, relevant information to help them feel better, look better, and live better. Here you will hear in-depth information about hormones, sexual medicine, aesthetics, cosmetic gynecology, and functional medicine.
Hey everyone. Today we're going to talk about something that I think y'all like. Based on when I look at what podcasts are the most listened to, it seems like everybody likes to hear the ones where we talk about sex, or we talk about the vagina and we talk about the penis. So today we're going to be talking about the vagina, and specifically a product or procedure or treatment called CO2 Lift V. V as in vagina. So we have, again, Lana Kerr. She was on our podcast a while back. If you missed it, go check out episode 9, where we talk about Carboxy Therapy or CO2 Lift for the face, and a treatment you can use to get glowing skin, or it really affects all aspects of facial aging for beautiful skin. But today we have her back to talk about CO2 Lift V. So welcome back, Lana.
Thank you, Amy. It's good to be back. Thanks for inviting me to talk about this very important topic. In fact, it's my passion.
Yeah, so I guess my first question is, we talked last time about kind of the science behind carboxy therapy, and I encourage people to get the long version and check out our other podcasts when we spoke. But if you can just give people a quick overview of what carboxy therapy is.
Of course. So carboxy therapy is a therapeutic use of carbon dioxide in its gaseous state. And it's really been done since the early 1930s. It was administered with a subcutaneous injection of CO2, and the benefits of that are incredible. But 5 years or 6 years ago, we created the first gel delivery system of CO2 into the skin. And, one of the physiologic effects of using the CO2 lift carboxy therapy is that you're going to increase tissue oxygenation, you're going to increase the flow rate and vasodilatation, you're going to clean the extracellular matrix for improving tissue health, create biostimulation of the connective tissue, and really contribute to the restoration of the microvascular tissue unit exchanges. And all of that to say that it's very quickly regenerating the tissue of the skin, whether it be on the face, the neck, the body. And now in the case we're talking about, the most important skin, the skin between our legs, our vulva vaginal tissue.
Yeah, which, I mean, that tissue is really important. And what I found is sometimes people don't realize it's a problem until they get in this bad cycle of, oh, sex hurt, I'm not going to do it. Then they go months, sometimes even years. And then something clicks and they're like, okay, now I can't have sex anymore. I better come to the doctor. And it's so severe. So I love what you're doing with this company and getting the word out of how important it is to take care of that skin and tissue between your legs before it becomes a serious problem.
Yes, no, definitely. The thing is that, especially, it's the whole psychology of us as women. We just kind of relegate the benefit or the pleasure of even sexual intimacy to our partner, as opposed to recognizing that this is something that we really use to help our relationship with ourselves and in the relationship with the person that we're in the relationship with. So we need to really pay attention to that area. And the CO2 Lift V is doing that in many ways.
So you originally developed it, I would imagine, for vaginal atrophy or the changes that occur when you go through menopause or your hormones decline?
Yes, it's very similar when we thought of even with the CO2 lift for the face. It was always when we thought of it, it was about regenerating the tissue for skin that's maturing. But when we recognized how beneficial it is for maintaining skin and for keeping things healthy, and it's easier to maintain something than reverse it. We saw that the CO2 lift V is really not only for aging and issues with when you have problems, like I'll get into how we actually started it, but it's for even younger women who are in a good state to maintain it. It's easier. But just to kind of get into how we thought of the idea, because the CO2 lift carboxy for the face and body, that is how we started. Maybe about 3 years ago, 4 years ago, and is when we thought of the CO2 Lift V, and like really everything that I've ever been involved in, it always kind of starts with something that is personal to me. And so maybe about that time, I was in my mid 40s. I'm now 50, but I was starting to feel different in, how I felt when I had sexual intercourse. It was just not the same for me.
Yeah,
I mean,
it's just
I'm
not the same. Yeah, when you go through you're like, wait, what is happening? Like, it's taking longer. Like, my mind starts wandering. We're like, okay, this isn't how it used to be.
Yeah, and not only that too, Amy, it was just like I wasn't feeling my husband. Like I'm like, he's just not, I'm not feeling him inside. I'm thinking, okay, he must be shrinking.
Yeah, it's his fault. Yeah.
I know. So I had gone to my GYN, and she did my exam, and I was telling her how I felt. And she just said, Lana, you're getting older. She did my exam. She said, you're lubricating fine. When you get older, you lose sensitivity. And she said she had the Mona Lisa Touch, which is a laser device. And she said that, we can maybe think of doing it on your next visit, because she didn't feel that was even needed now. But, I'm all about quality of life. And I'm like, okay, this is not about getting older, and I just have to accept this. But when she said the laser device, I thought of the CO2 lift carboxy, because as we discussed the last time, carboxy therapy is regenerating the tissue similar to laser. Laser damages the skin to be able to create this process to start, whereas CO2 lift, when you put CO2, that process or angiogenesis is going to start taking place without pain. So we started our first clinical on a small set of women. It was 10, and we used we used an FSFI questionnaire to evaluate their progress. We used the Gloria Bachman, and we used biopsies, and it was conclusive that all women experienced improvement in their lubrication, greater orgasms, less pain in sex, just more sensitivity with using the CO2 Lift V. So we were totally excited, and I was excited to try it myself. So, I tried it. I did the 10 because that was what was done in the study. I did one every other night for 10 nights. And Amy, I don't know if it was mind over matter. That's what I thought at first. I'm like, this could not be such an improvement in such a short space of time. It was like, they say you don't remember until you remember. It felt better than I even remembered it. And I was like, this is crazy. But I wanted to test it on some other women who I knew would be totally honest with me, like my mother and my aunt. And we had that very strange conversation with her about her own experience with sex at this age with my father. And I was like, okay, maybe this is a little too much information for me. But basically, she told me that it was just like sandpaper, and that before she actually had sexual intercourse, she had to douse herself with coconut oil just to kind of get through it. And I thought to myself, Mommy, how can you? That is so not fun anymore.
I know. That breaks my heart when I hear I just have to get through it. I'm like,
Can you believe that, Amy?
it doesn't have to be that way. So,
Oh my gosh. But Amy, I said, Mommy, so when would you have this discussion with me? You would pass on, and then I would get to your age and be experiencing this. I mean, at least let me know what is coming to me, you know? So she started experiencing that in her late 60s. She said when she was 69, that's when she actually saw a big, it was just uncomfortable. Anyhow,
well, she's pretty lucky because most people start having issues way earlier than that.
Yeah, I think it was just that it was unbearable at that time. For her, it was just unbearable for her. And she went from sandpaper to butter. And that was the experience of my aunts. And it was really at that point that I thought, this is going to be so helpful to so many women. So I really got excited, and we created the CO2 Lift V. And from that point, we've had, so many women, all ages, from women who just had children, women who've been on chemotherapy, my age, or just women who just want to improve that experience for themselves, have been benefiting from CO2 Lift V. So I'm really, when people ask me sometimes what business I'm in, I tell them I'm in the relationship business. I really help improve people's relationships with CO2 Lift V, improve the relationship with themselves as well as with their partner.
So it's interesting. You said you've used it every other night for 10 nights. I personally, I don't have an issue, but I'll be a 52 in a month or so, and I've been taking testosterone therapy, and I regularly, just for maintenance, do the O shot. I've had radio frequency, again, just to kind of maintain things. So I don't have an issue, but I know the science behind CO2 Lift V. So my protocol for myself was to just do once a month. So maybe I should do a loading. Do you think I should do a loading dose of?
Something? I like loading doses. I mean, the minimum loading dose is 3, just like in the face. It's 3. So you see we have the 3 and the 5 pack. I did the 10 because, again, we just started and I didn't know what to expect. And that's because that's the protocol that they had used on these menopausal women. But yes, you don't need to, if you've been maintaining that with all the things you were doing, that's great, then simply to maintain that once a month. But I always like a loading dose to really bring everything, the levels high, at least to 3. So I would say at very least one should do one every other day for 3 treatments, for 3 days, for 3 nights, or one every other night. So 3 treatments every other night. And then you can maintain with monthly treatments.
Got it. So when we say do the treatment, some people might not even know, well, what does that mean? Let's go over how to actually do it. I know it comes just like the face with 2 little packets, and you mix it together and then apply it and leave it on for a minimum of 45, or not a minimum, but you leave it on for 45 minutes for your face, and then you take it off. So for the CO2 Lift V, I know I've done it where I've put it on and then go to bed. So, and I know I've heard you speak of that's what you do too. But my biggest question is when you go to bed, do you put your panties on, or do you go to bed without panties? That's my biggest question.
Yeah. I use a pad. So I use a pad and then put panties on and go to bed. And in fact, because I find it's very comfortable. It doesn't feel icky or anything like that. It just feels very comfortable. And then, when I wake up in the morning, you just use the applicator, fill it with water, and then just kind of wash it out inside. You want to do 2 or 3 washes and then wash on the outside. And then if you actually have intercourse right after that, it's just, oh my gosh, my husband says it's like hot sauce that should go on everything, except that it doesn't burn, but it's just wonderful. But yeah, the minimum time though, even for the vagina, is 45 minutes. Sometimes, for me, when I'm going even on like a trip away with my husband, we do these, sex weekends sometimes, and I remember last time I had
I love that you do that. Like my husband and I do that too, of even if we just go away for the night in Cincinnati, And we just say, like, we're literally just going to have a night in a hotel 'cause there's nothing better than hotel sex, I
Oh
think.
my gosh, yes. It's such a great way of connecting with each other. I'm telling you, you kind of just really work a lot out during that time. And we've really found that very helpful in our relationship. So we do those nights out too, where you just kind of just spend time doing that. So I
Same. But
was
go ahead.
at but so I was at the the acupuncture, I was going to meet him at this hotel down on the beach, and so I was coming from my acupuncture office. At the acupuncture office, I just went to the bathroom, put in the CO2 Lift V, and then went in the room and she did her thing, and then I went back to the bathroom and took it out. So in other words, it doesn't have to be asleep throughout the whole night. You can do it, you know, you can do it if you're working on your computer. You can put it in,
Okay.
so you can do it anytime. It's just convenient monthly for me to do it at night because then I don't have
So
to
you
think
don't
about
have, you
it.
don't have to be laying down. You could just put it on and be, doing your day.
Yeah. You put it on. I mean, you don't want to go and run a marathon or go and maybe run, do the treadmill, but certainly it's not going to fall out. If you put it on, you make it kind of set for about 10 minutes. You can walk into the kitchen, cook dinner. It's not going to drop out.
Got it. Okay. So after the loading dose, how often do you recommend somebody use this?
At least once a month. At least once a month. So just to kind of, Amy, with this, there's no pain at all. For those of you on the call, there's no pain. It's very comfortable. It's very cooling. So even some women who have burning vaginas, it's just very cooling. But it's a medical treatment that you can do at home on your own. So it's just because it's a gel, don't think of it as something that's like we talked about it the last episode, like one of those $2 gel things that you can buy in a pharmacy. This is a medical grade treatment that is just, before this time, the only way to get this done was in a doctor's office with a needle. Now you can apply it to yourself at home, no pain. You put it on inside and outside and leave it on for a minimum of 45 minutes, or just go to bed in it and wake up and take it out in the morning.
Mm-hmm. So I know your initial indication or plan for it was for vaginal atrophy, but in my practice, I just have seen amazing results. So we use it for so many other things, for recovery after a cosmetic surgery, such as a labiaplasty, or even our Aviva, our non-surgical labiaplasty. It just helps with the healing. We also use it for lichen sclerosis of either pre-treatment. So when we use our laser, people who have severe lichen sclerosis and have the double whammy of lichen sclerosis plus atrophy, they have a hard time actually recovering from our laser therapy. So I like to pre-treat them with the CO2, as well as for women that have just kind of loose skin of their labia majora and they don't want to do something that's more expensive or more invasive, like a labiaplasty, labia majoroplasty. So we have found so many other indications for using the CO2 Lift V.
Oh yeah, it's you said them all. I mean, especially when if it's, for instance, any labiaplasty, I think the prep, any surgery, but now we're talking about for that area, definitely we always encourage a minimum of 3 gel treatments prior to the procedure. We always talk in threes, but 3, and then 24 hours post procedure is great, and then every other day to kind of really recover very quickly from that. But even with lasers, that you're doing or any kind of energy-based device, it's really the combination therapy. We talked about it last time. It's like the 1-2 punch. You're just approaching the same problem, but from 2 different ways of solving it. And I think that just works great in combination for really any procedure that you're going to do down there. But you talked about the cosmetic benefit, even as a standalone. I think that for us, when we saw the first set of pictures, it was really something we did not expect because we were just addressing functionality. But when we saw the pictures of how the improved skin, we were so excited about that, in terms of making it plump and soft and tight. And that area, even for pleasure, it's just on the vulva. Many people don't, that area is so important in the whole experience, making that area just fresh and full of blood is just so important. And that's what you're doing with the CO2 Lift V.
Yeah, it's more than just the clitoris. There's actually erectile tissue kind of all over the vulva, not just the clitoris.
Yeah.
So.
And something, Amy, we talk about, sex and how you introduced in the beginning, and most people are interested in hearing about that, but it's not, even if you're not sexually active, it's they say muscle, if you don't use it, you lose it. So for people who are not sexually active, a way to maintain that tissue, that area, if you're not using it, this is a great way to do that, so that when you're in a relationship and you're using it, you are right back in business. It's like going right back on a bicycle. So I think it's about maintaining that area. And even for older women who are, who just because they're getting more infections, because their pH is changing, this is able to keep that area, the correct pH is going to keep their vaginal tissue healthy so they can feel good in their skin. Because especially as a GYN, I'm sure you can see that, women as they get older, sometimes they have burning vaginas.
Yep.
You examine the tissue, and this is what I'm hearing from other physicians like yourself, they're so thin, you can't put anything there. So it's not just about sexual intimacy, or sexual intercourse, with a partner or anything. It's about just maintaining that area, keeping it healthy so you can feel good. Would you agree?
Oh, I totally agree. Is when the tissue gets severely atrophic, you can have burning just throughout the day, not even with intercourse. And estrogen has always been the go-to, and traditional gynecologists that, aren't maybe well-versed in sexual medicine and have all of these tools in their office, usually just use estrogen. And I definitely think there's a place for using estrogen, and estrogen helps, but it just takes a long time of using estrogen versus CO2 Lift literally helps immediately.
Yeah. And then the psychology, we I was talking to somebody else. We're talking about, just celebrating being a woman. We take care, that part is what makes us a woman, right? It makes us, having a vulva, vagina, it's that to take care of that. We take care of the skin on our face, on our neck. Taking care of that area really allows us to feel very powerful with our feminine power. That's, so it kind of sets the stage for who we are, as in my opinion. And even talking with therapists who work directly with women, and going back to the sex argument, is that, we have very few cues, sexual cues as women. Like men, the breeze will blow and they will think about sex. For women, we have so many other things on our mind. So the act of taking time to take care of this just brings attention and awareness and presence to the fact that we are a woman. We are, when if we do have sexual intercourse, we're expecting it to be comfortable. We're expecting it to be pleasurable. Those things all are, kind of set the stage for us to have a very good experience.
Right. I don't know why it took me, we've been using this in our practice, not that long. And I think CO2 Lift, it's pretty new. How long has it been out?
So the CO2 Lift V, officially we launched it actually this year. We had a soft launch last year, but then COVID kind of messed things up. But we've had it out for some time, just because before we actually wanted to launch, we wanted experience with physicians using it. So we have quite a bit of experience of women using the product. But the CO2 Lift brand, it was started in 2015.
Yeah, so I guess we're not too late to the game. We've been using it, maybe 3 or 4 months.
Yes, no, not at all.
But I recently heard you speak, or maybe read Alansad speak, of the original data was for wound healing, and
yes.
And using it postpartum after healing for an episiotomy, or like in my situation of when I do surgery on the perineum, whether it's for prolapse or for cosmetic reasons there's a lot of downtime with those surgeries. So I really have been recently encouraging people to use the CO2 Lift V to enhance the recovery, because the data originally was with wound healing.
Yes, like most things aesthetic, it starts with wound healing, because when you can find something that quickly regenerates tissue, and you're talking about something that the carboxy gel can really close a non-healing diabetic ulcer wound in as little as 8 days. I mean, really, that just kind of speaks for it. You put this gel on something that cannot heal and is going to very quickly regenerate the tissue of the skin. So then if you think of the applications for this, for when you're doing surgery, it's the same thing. That's why, or when a woman, just has a baby and, she wants to recover that area. I can remember, oh my goodness, my youngest is going to be 18 this month. And I can still remember, though, after the soreness and you're just going into the sitz bath and you get so sore down there. If I had something like this, oh my goodness, you're talking about very quickly putting the cooling effect of it and how quickly you'd repair that area and how quickly you can go back to, your relationship. Because I remember even, one of the strains in our relationship after both my sons, it was just, I didn't feel to go back into intimacy for a while. I remember my friend who she delivered my first son. I remember asking her to write a note even at the 6 weeks mark to say, you can't have sex still. You know what I'm saying? Because I just was not in the, and that kind of it brought some issues in our marriage at the time. But if I had something like this, oh my goodness, it would just quickly bring me back to who I was. So that, because of, when you have a new baby, I think it's important to really connect again with the person who helped you have this baby.
Right.
And so by doing this, it would have helped me. And so for all the new moms out there, what a great way. And especially if you're breastfeeding, because, in breastfeeding, and I breastfed each of my children for Ty, I breastfed until I got pregnant with Lane, and then with Lane, I breastfed him for 2 years, and it causes, dryness down there.
Yes.
So for women breastfeeding, I think that's so important to get back, and certainly for all women to take care of that area.
Yeah. So it's become my new gift for pregnant moms. It's my new baby gift, and for women who are getting married. So
yes,
it's my new shower gift that I give to people. So
it's a wonderful. That is such a great idea. It's such a great idea to do that. Or some people have these divorce. I've heard, these divorce parties, or this is a great gift.
Yeah, you're right. I love it. So thank you so much for joining us. This was a lot of fun. And I think that people will like this, talking about the vagina.
Oh, Amy, thanks again. Thank you so much for being for being this type of physician you are, that's bringing a lot of education to women, that's really helping women, not only, their whole self, top, face, neck, vagina. I think that's so important, and that you're interested in the quality of life of a woman. I'm so glad that you invited me on your platform and that you're having these type of talks with women. Thank you so much.
Oh, thank you.
Thank you for listening to this episode of HealthiHer. You can find us on Instagram, Facebook, and the web. Go to www.dramybrenner.com to learn more. This podcast is for general information only and does not constitute as medical advice, the practice of medicine, nursing, or other healthcare services. No patient-physician relationship is formed. The information in the podcast and any references, material, or links are at the sole discretion of the listener and not meant to be a substitute for professional medical advice, diagnosis, or treatment. Listeners should not delay or disregard obtaining medical advice for any medical issues or diagnoses that they may have, and should seek medical advice from their healthcare provider for any such conditions.